Welcome to Healthy Newfoundland and Labrador. This education and training module will provide you with information about the key features of Healthy NL, including broadcast messages, change password, columns sorting, the left navigation menu, my details, printing, provider search, recent work lists and work lists configuration. The Healthy NL Viewer includes a messaging system that allows users to receive information from Healthy NL regarding system outages or updates. Users have the ability to view and delete individual broadcast messages through Viewer. Broadcast messages are accessed from the common menu or from the clinician homepage. A broadcast messages is sorted by date. The following message attributes apply: bold equals unread message, normal equals read message, read equals high priority message. Read or unread attributes also apply. Received messages may be sorted by clicking on the data element column label. From this screen, a user may also delete a message that is no longer required. A detailed view of a broadcast message can be viewed by clicking on any of the information fields in the message list. Users can manage password changes outside of enforced timeframes by using the Change Password feature in the common menu. The user is redirected to the password change page. The Healthy NL Viewer collects old password and new password, twice, and submits the responses to the centralized administration system. By default, summary screens are sorted, in descending order, by date, or severity and date in the case of allergies and adverse drug events. This includes medication summaries, allergies and adverse drug events, devices and broadcast messages. By default, the medication summary is sorted by date prescribed, then by date dispensed. The results can be sorted in ascending or descending order by clicking on the data element column label. All information in these screens can be sorted by the following columns: drug, prescriber, prescribed date, status, and dispense date. Click the column you wish to sort the summary screen by. Click the column a second time to arrange in the ascending order. When sorting alphabetical listed columns such as drug, the system sorts the new list alphabetically. However, it is also case sensitive. Therefore, all lowercase results are listed first A to Z, and subsequently all uppercase A to Z. The My Details page enables you to view basic information about your profile. You can also select and manage work lists from this screen. Important note: at present, one favorite work list can be selected to display on the clinician homepage. Otherwise, all work lists will be displayed by default. To select a favorite work list to show on my homepage, click the magnifying glass icon. On all clinical information health viewer pages, you will find a printer-friendly version link so you can print data as needed. The print job will render to a PDF file, which can then be sent to a printer of your choosing. Please note that clicking on the printer-friendly version link will not only print the data shown on the screen, but will also provide a printout of the complete set of data available in the relevant table. That is, if there is more than one page of results, the printer-friendly outputs includes all pages, not just the page on screen when launched. The printout will also include header and footer information that includes patient identification information, header, and user information, footer. Important note: there is a minor compatibility issue with Adobe version 11. When printing detail screens, the print command window pops up behind other windows and cannot be made the active window or focus. To remedy, click on the edge of the window with your mouse to pull the print window into view. The provider demographic search allows the user to search for the following registered provider types: nurses, nurse practitioners, pharmacists and physicians using their demographic information. The provider demographic search is available from the left navigation pane. By default, the provider demographic search returns only active providers. To include inactive providers in your search, uncheck the Active Only tick box. Identifier refers to license number. The identifier type denotes which type of provider you are seeking, that is physician, registered nurse, etc. When searching by provider demographics, the user must enter both the first and last name, or enter both the last name and provider type. Wildcards, % or asterisk, can also be used to search for a provider. To use wildcards, you must have a minimum of 1 character and a wildcard. As well, characters in both the first and last name fields are required. A maximum of 100 search results are returned. The recent work lists shows the patients whose profiles you have recently viewed. The work lists displayed are for today, the last 7 days, the last 4 weeks, and the last 12 months. The recent work lists are system-managed lists and are automatically populated based on viewing of patient records. If you are a new user, these lists will not be populated, but will fill up over time as you look at patient profiles. Work lists can be sorted by the column headings. However, when this is done, all patients will appear in the one recent patient work list. This sorting will remain until the user clicks Remove Sorting. When this is clicked, the recent patient lists return to normal, that is, all work lists are redisplayed. Patients can be removed from the recent work lists by selecting the box to the left of the patient's name and selecting Remove. The maximum amount of patients in a recent work list is 50. After this limit is reached, the least frequently accessed patient will be removed from the list. The page can be accessed via the common menu on the left side navigation pane or through the clinical homepage. This page displays a maximum of 6 work lists that can be configured by the user. The default work list names are red, yellow, orange, blue, green, purple. These work lists can be renamed by the user based on desired function, such as My Diabetic Patients. To change a work list name, click on the Rename link. Once you have clicked on the Rename link, you can rename the work list by typing in a new name in the area provided. Use the column selector to add or remove columns for your work lists. Please note that each work list is unique. If you wish to add or remove columns, you will need to adjust each work list individually. To remove a patient from a work list, check the box to the left of the applicable row and click the Remove button. The Key Features online training module for the HEALTHe NL Viewer. Please visit the website provided for more education and training information and material.